Good morning, welcome everybody. Adrian and I are going to do a bit of a double act, leading on from what Chris was saying to you earlier about the journey we've been on. We thought it'd be just helpful just to give you some insight really into how we've got where we've got to and what it's felt like along that period of time. So I'm Carolyn Terry, this is Adrian Coggins, in case you're in any doubt which one was which. Okay, so when we were having the conversations earlier on that Chris was talking about from his experience of talking to families, we knew we had an opportunity to actually think about making things different. And what was it that we could do? What could we influence and what opportunities did we have at that point to really think about creating a system that was more joined up, thinking about how we would actually connect, work differently and think about it differently. So we did a lot of work thinking about the early years system. And then we had to start somewhere and we had to look, as I said, those opportunities that were presenting themselves to us at that time. And what you can see on the screen are the contracts that we actually put in together into the Essex Child and Family Wellbeing Service specification. But of course, putting all of that in together is not enough. We need to really think about how it was joined up. We had to think about the workforces we were putting together. We had to think about how people felt about their own identity, their professional identity, and think about what that meant for families as well. Because just to say we'd put these contracts together wasn't enough. So throwing them together, what does that actually mean?
So you can kind of read that, but I want you to kind of focus on me. So put your eyes on me, okay? I'm going to hypnotise you all. I'm going to get you to do really embarrassing things, okay? And now I've planted the seed of doubt that actually I might do that, which kind of excites me in a way. Can you stand up, please, if you drove here this morning? So stand up if you drove here this morning. Brilliant. Can you remain standing if when you got in your car, you thought, I need to go to a particular destination, I need to have an outcome of arriving here this morning? Can you sit down if you got in your car and you thought, I'm just going to go for a random act of driving and see what happens? Oh, wow, okay. That's amazing, actually. That's brilliant. So I'm really pleased that you all got in your cars and you had the outcome of arriving here today. And I'm pleased about that for a number of reasons. Firstly, you're not randomly distributed across the country of England. And secondly, we'd have too many sandwiches left over. So that's one good thing. But the other good thing is that means you kind of get what an outcome is, okay? So you demonstrated in your journey here this morning what an outcome is. My challenge to you, and I'm happy to be challenged back on this, is why, in that case, if we understand what an outcome is, we could actually do such a poor job of commissioning and delivering outcomes in a system approach, and we focus far too much on activity. So that's my kind of healthy challenge to you all. Thank you. Next slide, please. I'm glad you're doing that, so I'm not really sure how to operate it, so that's good. Is this me still? This is me still, thank you. Right. So, a healthy challenge to the Healthy Child Programme. So the Healthy Child Programme, 0 to 5 Healthy Child Programme, is the mandated health visitor reviews. So every local authority in England, there's nobody here from Office of Health Improvement and Disparities, is there, by any chance? Phew, that's healthy. Okay, good. What we are all mandated to do is to measure the number of health visitor reviews that happen, okay? I don't care about the number of health visitor reviews that happen. Let me just qualify that. What I care about is what that leads to. There is a very healthy ethos in which the Healthy Child Programme is rooted. So we know that people need support, family needs support to achieve outcomes like making sure there's good attachment between children and their parents, making sure that all children and parents have good emotional well-being, and that parents have good emotional well-being during the perinatal period, for example. And I've just chucked in 3 of the outcomes that we actually commission in Essex. So I think, and again, my challenge to all of us is, we can do a better job. We're trying in Essex. I'm incredibly proud of what we've achieved thus far. And this is just a celebration today. Just to see everybody here together is an absolute celebration for me. But we are partway along that journey. And I think our national challenge is how we get to a position whereby we collectively hold ourselves to account better for outcomes that we want to that we want to see. So mandated checks are a gateway, but they are only a part of the journey. Back at ya.
Thank you so much. Okay, I'll start with the photograph on the slide. I'm not sure whether any of you know who this person is on the slide. I have to say I didn't, and Adrian thinks I'm a Philistine. But on this slide is Miles Davis, who's a renowned trumpeter and composer internationally. And if Miles was here today, Adrian, what would he say?
He would be saying, play like you don't know how to play. Apologies, David, for the American accent, by the way.
Why is that important? Well, it's really important because if you carry on doing the same thing, you just get more of the same thing. And he was such an innovator in his music, and he was so inspiring for people to think about doing things differently. We've all got the technical know-how in this room. We know our own areas. You know, we're very secure in that. But actually, unless you start to think differently about what it is you want, you will never get anything any different. So if you can think about having Adrian in your head when you're thinking about your planning, if that's not too painful for you, think about where do we want to get to? Think about the journey you want to go on. And it's what you want, not what you've got, because otherwise that's exactly what you'll commission. And then when you start to think, why does it need to look different? You need to have those very, very real experiences that stay with you. You heard Chris talking very passionately still all these years later about the conversations and the experiences he had of visiting families. You need to have that, and you need to hold on to that to really think, why are we trying to do this differently? As it says there, blank sheet plus passion and ambition is the most powerful tool that you have. But don't underestimate the journey. It's really difficult. We've been very fortunate in Essex. We had a cabinet leader that believed in this. We had a senior leadership team across the council, and we had a director who was constantly challenging us to look at it differently. But it's hard, it's different. When the going gets tough, you revert to type. So you have got to have that blueprint. You have got to really think about why you're trying to do what you want to do differently. People around you will try and knock it down. People don't like change. People feel threatened by change. And you will find with yourself energy, you need so much energy to do this differently. So unless you've got that very clear vision and you've got that group around you that has got the energy to keep going and to regroup and keep going, it will always be difficult. So, thinking about commissioning, thinking about how we've been here for an outcomes-based, how do family hubs actually fit into this for us? They give us that opportunity to think about our new blueprint. They give you the opportunity to really think about this differently. You need that post-organisational approach that it talks about on the slide. You need the people around you. You need to think about what you want to be achieving. And when you're on the journey, think about the outcomes and try not to think quite so much about your traditional key performance indicators, because it's very easy to get pulled back into those and to start thinking about, actually, that's the easy bits to measure because they are the bits that we understand. They are the bits we can see. They are the bits we quantify. But keep those families with you. Think about the journey for those families. Think about what it is that the families want and what difference you can make by joining it all up together. It's that chance to do things differently. It's, as I said, it's thinking about the system. It's thinking about your contribution. And even if you are a small part, or you can only start with a small part of your system, it is worth undertaking that journey. So handing over to Adrian to think about what do we mean by the determinants of outcomes.
So I'm a public health specialist. Except I don't really consider myself a specialist because I look at my pretty much my entire career. I'm thinking I need to be more successful than I've been in my entire professional career to date in the short remaining time I've got left. I know I don't look old enough, but that's how it is. But the simple fact is, I think this is a great phrase, dear old Bucky here. Any boundary is a useful fiction. So we compartmentalise things according to what works for us. And anybody that is a right-thinking public health or well-being practitioner at the moment needs to be thinking about what are the broad determinants. I think Claudia described, what's going on under the surface. It's not just what people present with, it's the totality of their circumstances. That is how we must approach things. we are all dealing with a carve-up of commissioning responsibilities in a pathway. So, Carolyn and I commissioned some parts of a pathway from the County Council. Ros and NHS colleagues commission other parts of the pathway. That's okay, because we're joined up with West Essex, but a lot of it's not everywhere else in the country. And there are other organisations that commission another part of that pathway. So that compartmentalisation is kind of really unhelpful. I'm using this slide a lot at the moment. This is the Robert Wood Johnson Foundation. And what it basically tells us is that 40% of the determinants of health and well-being are socio-economic, okay? So I've spent a lot of my career looking at obesity and behaviour change programmes. I'm wasting my time, quite frankly, if I just commission behaviour change programmes without looking at the quality of people's jobs or friends or housing. So it's really important that we kind of recognise this, and I think we've got another slide, haven't we? That's it. Oh, that is it. Okay. So we haven't got another slide. Thank you. Good night. No, so just on this one, what we've got in Family Hubs is an opportunity to bring together as many of these determinants as we possibly can. So all under one roof is not enough. It's not enough to say we've got a particular target area or a particular group of people and we need to do a better job by them. It's not enough to say let's just do loads of stuff. Let's put lots of effort into that. What we've got to be much smarter about is what are the determinants of the outcomes we want to see, and how can we construct family hubs in a way which help us cover as many of those determinants as possible. Because when you get serious around outcomes, you start to think, what are the determinants of that outcome? So that's a different approach going forward that we need to look at. Thank you very much. Going to hand over to Ros.
Everybody, I'm Ros French. I'm Head of Children Maternity Commissioning for Hertfordshire and West Essex ICB, previously West Essex CCG, which is where the relationship started with the local authority around the Essex Child and Family Wellbeing Service. So I'm really, really grateful for this opportunity to be able to talk to you today about my experiences of commissioning in partnership with a local authority around this service. I joined the partnership about 18 months into the contract. I found it to be one of the most positive experiences of my career, not only because of the amazing people that I get to work with, and there's loads of faces of people that I work with around this room, which is fantastic, but because that we have this shared passion and commitment for improving outcomes for children, young people and families. And it's just amazing to see what we've achieved and what we continue to achieve as the service carries on developing. So my first slide summarises some of the national and local strategic drivers. Of course, when we were first developing this service, we were all talking about the 5-year forward view. So I've brought some of this back up to date with some of the key strategic drivers we're working on today, starting with one we're all very, very familiar with, which is the NHS long-term plan. So children and young people represent a third of our country. Their health and well-being will determine our future. We all know this, and all of us here will preach this to our organisations all the time. And we've been emphasising this, and about the need to invest that time and that resource into services for children, and the long-term plan really supports us to do this. The health of children and young people is determined by far more than just healthcare. Again, we all know this as well, and it's something that we need to work on in partnership across our local systems if we're going to achieve it. The next one on this list is called 20+5, and that's the most recent addition, driving that targeted action in healthcare inequalities, focusing on the most deprived 20% and population groups experiencing poorer health outcomes. In order to achieve this, we need to consider how we can work together to really identify these families and provide that targeted support holistically around their needs. It's been really important to translate all these national commitments and strategies into our local strategy. And I've put just a couple of examples here from Essex and our local ICS. These highlight the benefit of working together in partnership across systems and really adding value to each other's work. Also recognising the financially difficult and complex landscapes we operate in, and changing the way we work together, using real partnership to overcome barriers and involving children, young people and families in the work that we do. Ultimately, as an ICS, we want children to have the best start in life, with opportunities to be safe and well and reach their potential at school and beyond. And I imagine across this room, lots of organisations have very, very similar strategies and commitments. So this slide summarises our local partnership commission between the local authority and the ICB. The services in the blue box here are those commissioned by West Essex CCG, of course now Hearts and West Essex ICB, as part of the integrated Essex Child and Family Wellbeing Service. And that includes community paediatrics, which also includes ASD and ADHD assessments, children's community nursing, special school nursing, allergy dietetics continence, physio, OT and speech and language therapy, and designated doctors for special education needs, looked after children and safeguarding. These operate alongside the local authority commission pre-birth to 19 services, which is in the red box above. And family hubs provide a place for these services to really operate side by side, whether it be physically in a building or virtually. And together they can consider the health and well-being of a child and family beyond their immediate healthcare needs, which goes back to what we were saying in the long-term plan. The partnership offers the opportunity for joining up across universal, targeted and specialist services that step up, step down and that support all the way along the journey. So in addition to the local authority commission outcomes, the ICB aims to achieve the 5 outcomes which I've shown here. They focus on some of that traditional non-elective activity avoidance and multi-agency working, but they also focus on empowerment and resilience of children, young people and families in managing their healthcare needs now and into the future. Professionals can work with children, young people and families on these outcomes alongside other outcomes, some of which will be interdependent on each other, and they're not confined to any one service area. And these aren't just words that we throw into a specification. We actually measure these. And through the work of the Essex Child and Family Wellbeing Service in a very integrated model, the service is achieving 97 to 100% through this approach. So when thinking about what I really want to put across today, we asked ourselves the question, what has this partnership enabled us to do? And I've just put a scatter of a few examples across this slide. And in addition to some of what we've already mentioned, I'll just pick out a few. So one-stop shop. We all want to achieve a one-stop shop for families, get all their needs in one place. And this opportunity has really become more apparent in where HCRG have invested in one of the family hubs to now have some clinical space alongside the 0 to 19 services. Winter wellness advice and guidance delivered by a multi-professional approach as part of the family hub offer. And I know there's somebody in the room today, Jenny, who really leads that winter wellness initiative every year. Developing pathways from the point of prevention and early help up to specialist care and back down again. And that streamlined referral process and coordination through a single point of access. There's still a lot more that we can do through this partnership and with the local authority and the Essex Child and Family Wellbeing Service. Some of these I've listed here. So, enhancing join-up with our acute services, the paediatrics and maternity care. We now have a reference to the community and family hubs in their clinical strategy, and we're going to help them to deliver that. Enabling the delivery of national transformation at place. Many of you are already involved in the national transformation programmes that are coming down from NHS England. Being a key partner in local transformation programmes and working with other organisations across our counties to reduce variation and equity of access for our families. There is a role in social prescribing, and we do need to explore that further. And there's a need to consider other integration opportunities where these present. Finally, I just wanted to end with a few points of learning along this journey. Raising the profile of children's commissioning is about securing that really important strategic support and commitment for ongoing delivery from our organisations, particularly in light of that great organisational change that many of us are going through and with the financial pressures that we're all facing. Gaining hearts and minds, this is winning over our key stakeholders in the system, ensuring they're brought along the journey with us, helping them to progress their thinking on from traditional models and embrace change. Communication, this is key to maintaining the positive relationships and buy-in to the services in a world where there's an increasing amount of staff turnover and we're being bombarded with information from all angles, and we need continuous reinforcement of that message. Being overwhelmed. Now, this kind of relates to the family hubs being seen as that centre point of everything and enabling delivery of all our strategies and aims. Actually having to take that really measured approach as to what really can and can't be done in relation to the resource, the capacity, the space, etc. Finally, pool budgets, and that's with a big question mark. So the local authority and the CCG at the time chose not to do this. But there is a question as to whether having a pooled budget would have made a few things easier, particularly from an operational perspective.